Avoidant Personality Disorder, or AvPD, is a mental health condition. People with AvPD are often extremely shy. They fear social situations and worry about being judged or rejected. This fear can be so strong that it affects their daily life. People with AvPD want close relationships, but their fear of rejection makes it hard to connect with others. They may avoid social events or activities, and they might struggle to make new friends. AvPD is not just being shy, it's a serious condition that causes significant distress. It can affect work, school, and personal relationships. It's important to remember that people with AvPD are not choosing to be this way. They have a real fear that needs to be addressed with professional help. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, outlines specific criteria for diagnosing AvPD. A person must show a pattern of social inhibition. They have feelings of inadequacy and are very sensitive to negative evaluation. This pattern must be present in a variety of situations. Here are some signs of AvPD according to the DSM-5. Avoids jobs that require social interaction due to fear of criticism or rejection. Avoids interacting with others unless certain of being liked. Shows restraint in intimate relationships due to fear of shame or ridicule. Preoccupied with being criticized or rejected in social situations. Inhibited in new social situations due to feelings of inadequacy. Views self as socially inept, unappealing, or inferior. Reluctant to take personal risks or engage in new activities for fear of embarrassment. These symptoms cause significant distress and impact important areas of life. AvPD casts a long shadow over daily life. It affects relationships, work, and overall well-being. People with AvPD may struggle to maintain jobs, especially those requiring social interaction. They may avoid promotions or opportunities that involve increased social demands. Intimate relationships are deeply affected. The fear of rejection can lead to difficulty in forming and maintaining romantic partnerships. Individuals with AvPD often isolate themselves, missing out on social events and activities. This isolation can lead to feelings of loneliness and depression. The constant fear and anxiety can also manifest physically, with headaches, fatigue, and digestive issues being common. Living with AvPD is a daily struggle, but with professional help and support, individuals can learn to manage their symptoms and live fulfilling lives. The exact causes of AvPD are unknown. Like many mental health conditions, it likely stems from a complex interplay of genetic and environmental factors. Genetic predisposition plays a role. Individuals with a family history of anxiety disorders, or AvPD, may be more susceptible. Early childhood experiences such as rejection, criticism, or bullying can leave a lasting impact. A child who grows up in an invalidating environment may develop a heightened sensitivity to criticism. Temperament also matters. Children who are naturally shy or withdrawn may be more prone to developing AvPD later in life. Social learning is another factor. Observing parents or caregivers who are socially avoidant can contribute to the development of AvPD. Understanding the interplay of these factors is crucial for developing effective treatment and prevention strategies. AvPD versus social anxiety. Understanding the difference. AvPD and social anxiety disorder, often referred to as SAD, are frequently confused. While they share some similarities, they are indeed distinct conditions. Social anxiety disorder, or SAD, focuses on fear or anxiety in specific social situations, such as public speaking or meeting new people. People with SAD fear performing poorly and worry about embarrassment. On the other hand, Avoidant Personality Disorder, or AvPD, involves a broader pattern of social avoidance and fear of rejection that permeates various aspects of life. People with AvPD believe they are socially inept and feel inadequate. The key difference lies in the pervasiveness and the underlying beliefs. SAD is more situational, while AvPD is a more deeply ingrained pattern of thinking and behavior. The path to healing. Treatment and management of AvPD. Effective treatment for AvPD typically involves a combination of therapy and sometimes medication. Psychotherapy is the cornerstone of AvPD treatment. Cognitive behavioral therapy, or CBT, is particularly effective. CBT helps individuals identify and change negative thought patterns. They learn to challenge their fears and develop more adaptive coping mechanisms. Medication, such as antidepressants, particularly selective serotonin reuptake inhibitors or SSRIs, can be helpful in managing anxiety and depressive symptoms associated with AvPD. Joining a support group can provide a safe space. Individuals can connect with others who understand their struggles. Sharing experiences and support can be invaluable in the recovery journey. Treatment for AvPD is a process that takes time and commitment. With the right support, individuals can make significant progress in overcoming their fears and living more fulfilling lives. A brighter future. Recovery and the importance of seeking professional help. Recovery from AvPD is possible. With professional help and personal commitment, individuals can learn to manage their symptoms and lead full and meaningful lives. Seeking professional help is the most crucial step towards recovery. A qualified mental health professional can provide an accurate diagnosis and develop a personalized treatment plan tailored to the individual's specific needs. Early intervention is critical. The earlier AvPD is addressed, the better the long-term outcomes tend to be. Remember, you are not alone. Reaching out for help is a sign of strength, not weakness. Conclusion. Avoidant personality disorder can cast a long shadow over life, but it's important to remember that hope and healing are possible. With increased awareness, compassion, and access to effective treatment, individuals with AvPD can overcome their challenges and embrace a brighter future.